ADHD affects nearly 1 in 14 school-aged children in South Africa, but many go undiagnosed, untreated, and misunderstood. For families who can't afford monthly doctor visits, red tape can make access to life-changing treatment nearly impossible. Today we're joined by Professor Renata Schoeman, who is a psychiatrist and head of the MBA in Healthcare Leadership Program at Stellenbosch Business School. She's here to explain the long-term impact of untreated ADHD in children, the urgent need for policy change, and what parents, teachers, and policymakers need to know. Dr. Schoeman, good morning to you and welcome. Thank you very much for your time. I think it's important to just start with the basics. What exactly is ADHD and how does it typically present in children, especially in environments like the classroom or at home?
Morning, Iman. So ADHD is a neurodevelopmental disorder, and we diagnose it according to a strict set of diagnostic criteria which focus on symptoms such as inattentiveness, hyperactivity, and impulsivity, which is there since birth. It lasts throughout the lifespan, and it's also present in different domains, as you mentioned, in the classroom, in social circumstances, at home. So it might affect a child's academic functioning if they cannot pay attention, they cannot absorb material, they cannot follow instructions. So we have the academic fallout that we often see, but not necessarily, because you also have children with very good skills that can compensate. But we also see social and peer difficulties. They might be impulsive, they might bump into someone, they might say things, shout things out in the classroom, or just take decisions which is not necessarily the best, or thinking of the consequences. And then there is the busyness, the hyperactivity that we also often see, the fidgetiness, the running around in circumstances where it's not appropriate. But it's very easy to also miss other symptoms, which is associated like emotional dysregulation. Now, unfortunately, due to a lack of awareness and understanding of the condition, these children can often be labeled as naughty, stupid, or lazy, where in fact they have a neurobiological disorder that can very effectively be treated with medication. When it goes untreated and undiagnosed, children do not get the necessary support. And we often see then comorbid problems, which means they can develop poor self-esteem, anxiety, and depression, substance use disorders. And what was really for me sad is where they just fail to reach their potential and often drop out of the school system as well, or fail to realize their academic potential.
All right, so there's a lot that you've presented us with there, especially the part where the concept of children just being too naughty or too energetic and what that leaves behind in them in terms of behavior, their responses, things that they carry into their adulthood. Just talk to us about the long-term impacts of being dismissed in that way, or being labeled in that way, or being ostracized and isolated by people in their social settings.
Yes, I think, as I mentioned, that label of naughty, stupid, lazy, it's often then being internalized into the child's self-concept and poor self-esteem. And therefore, when they are being socially ostracized, they often start to associate it with other children that might have the same problems or different problems. And then they often just give up. And what we also see in the really under-resourced communities is that this is often the kids that's also then pulled into other peer groups where they feel they belong, where we see gangsterism, substance abuse, etc. We must also know that there's one group of children that we often miss, and that is girls with ADHD. Girls with ADHD often compensate, they're more socially aware, and they become extremely anxious, but they can modulate their behavior better. And then also the daydreamers. So if you have a girl in class that's a daydreamer, they're not necessarily a problem, they are often going undiagnosed. And they then develop depression, anxiety, and so forth as well, which can really have a long-term impact on people's emotional well-being.
If we can, we'll come back to some of these manifestations, especially in adulthood, and what treatment is available there. But you strongly argue for better access to medication like methylphenidate. How does treatment, when done right, transform a child's life?
I almost don't have words. I mean, the feedback that you get from patients, whether it's children or adults or the parents of children, is just how it improves everything. The children often say life is much nicer. They understand school, they enjoy school, they feel more clever, but they're also less in trouble. Or they even feel that the adults in their life improve because the adults is not on their case anymore. They're not always in trouble, but they have a sense of relief. Their mind is quieter, they can focus, they can absorb, the friendships goes better. So it is just really life-changing in terms of their quality of life. I think the things stand out for me is even in young children that can struggle with things that they're aware of that they struggle with, and the friends get it so easy, they really grapple with it. And then when they come back, when they're on treatment, literally the next day, they just can tell you things like, the butterflies in my head is quiet. I can listen to what teachers say. Or school is not that difficult. I'm cleverer than what I think. So as I mentioned, it's not necessarily academic fallout that we see, but just this whole sense of the child is less overwhelmed and more able to live up to their potential.
Importantly, though, when you talk about that particular drug, it's a scheduled drug in South Africa as a Scheduled 6 drug. So many children can't access the medication consistently because you need a doctor's appointment. Some can't afford that before they are prescribed. So talk to us about the real-world impact of the red tape on families, schools, and the intended health outcomes.
I think it's important to understand that there's a systemic issues here involved, which we cannot fight in isolation. Everything from methylphenidate is not on the essential medicines list, so at this stage, the government is not obliged to have it available, and we see it in different provinces. When in some provinces it's available and others not. As it is currently a Schedule 6 medication, as you mentioned, you need a monthly script from doctors. Now, doctors try to assist by giving pre-dated scripts, but that means doctors is contravening the law at the moment. So we cannot do it, and we should not do it. There's also technological tools available more in the private healthcare space where we can do electronic scripts that is available monthly, but especially in the public space. So already this is children that struggle to get access to mental health services. Now there might be some of the lucky few in the public system that get access to the diagnosis, but then they don't have the care because they get a script, but now they never get a follow-up script. The medication is finished at the end of the month. They cannot secure a doctor's appointment, or they cannot afford a doctor's appointment. Even in people that can afford, maybe in the private system, I got an email 2 days ago from someone that read the article I wrote that said, this is my reality. I need to take 12 days leave a year. And my child missed school 12 days a year because we need to go and see a doctor for monitoring of the child, for weighing and measuring, just to get a new script. Now, it's important that we have to reevaluate the children, and we do need to measure their growth and everything, but monthly is really, really excessive. And if we can reschedule the medication, for instance, like they've done in certain states in Australia, where it's one schedule lower, we can then supply a child with a 6-month repeat script, as we do with other psychiatric medication like antidepressants, which will then mean only a 6-monthly doctor visit, which make it way more accessible, way more affordable, and the compliance and adherence to treatment much better.